Miconazole 1 kit is used to treat vaginal yeast infections. It helps reduce vaginal burning, itching, and discharge that may occur with this condition. This medication is an azole antifungal, which means it works by stopping the growth of yeast that causes the infection. The vaginal product comes in two forms, a vaginal cream or tablet. Some products also come with a skin cream to be applied to the area around the outside of the vagina. If this is your first vaginal infection, it's important to ask your doctor before using this medication for self-treatment. Miconazole 1 kit only works for vaginal fungal infections. If you have a different type of infection, such as bacterial vaginosis, you may need a different medication. It's important to note that if you have fever, chills, flu-like symptoms, stomach/abdominal pain, or a bad-smelling vaginal discharge, do not use this medication. Contact your doctor right away because these may be signs of a more serious infection. If you are using Miconazole 1 kit to treat yourself, make sure to read all the directions on the package before using it. If you have any questions, consult your pharmacist or doctor. This product is only for vaginal use. Before and after use, wash your hands. Avoid getting the product in your eyes, and if it does, wash your eyes with plenty of water and contact your doctor if irritation persists. The dosage of Miconazole 1 kit depends on your medical condition and response to treatment. It is usually used once daily at bedtime for 1 to 7 nights, as directed by your doctor. If using the vaginal cream, follow the package instructions on how to fill/use the applicator with the cream. Lie on your back with your knees toward your chest, insert the applicator filled with cream into the vagina as far as it will comfortably go, and slowly press the plunger to apply the cream. If using the vaginal tablet, unwrap it before use and follow the package instructions on how to fill the applicator with the tablet. Lie on your back with your knees toward your chest and insert the tablet or the applicator into the vagina as far as it will comfortably go, then slowly press the plunger to release the tablet. If you have itching/burning around the outside of the vagina, vulva, apply the skin cream to that area usually twice a day for no more than 7 days. Do not use tampons, douches, or other vaginal products while using this medication. Continue to use Miconazole 1 kit every day for the full time prescribed, even if symptoms disappear. Tell your doctor if your condition does not improve after 3 days or lasts more than 7 days, or if your infection returns within 2 months. You may need a different or additional medication to treat your condition. If you experience headaches, vaginal or urethral burning, itching, pain, or lower abdominal cramps while using Miconazole 1 kit, it's important to notify your doctor or pharmacist. It's also important to remember that your doctor has determined that the benefits of this medication outweigh the potential risks. While serious allergic reactions to this drug are rare, it's crucial to seek medical help immediately if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. If you notice any other effects not mentioned here, be sure to contact your doctor or pharmacist for further guidance. Remember, this information is not exhaustive, so always consult with a healthcare professional if you have any concerns or questions. Before using Miconazole 1 kit, make sure to inform your doctor or pharmacist about any allergies you may have, especially to other azole antifungal agents. This medication may contain inactive ingredients that could cause allergic reactions. If you have diabetes, immune system problems, or frequent vaginal yeast infections, it's important to consult your doctor or pharmacist before using this medication. Also, be sure to inform your doctor or dentist about all the products you use before having surgery. If you're using Miconazole 1 kit, it's important to ask your doctor about having sexual intercourse, as this product may weaken rubber products and lead to failure. Be sure to use alternative forms of barrier protection/birth control during this time. If you are pregnant, do not use this medication for self-treatment. It should only be used when clearly needed and under your doctor's instructions. Discuss the risks and benefits with your doctor. If you are breastfeeding, consult your doctor before using this medication. It's important to follow your doctor's instructions on how to use the applicator to insert this medication. It's important to be aware of potential drug interactions that could affect how Miconazole 1 kit works or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Miconazole 1 kit is warfarin. Always consult with your healthcare provider before taking any new medications. If this medicine is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Remember not to share this medication with others. To help prevent vaginal yeast infections, make sure to thoroughly dry the genital area after showering, bathing, or swimming. Also, try to avoid wearing tight jeans, nylon underwear, pantyhose, a wet bathing suit, or damp/sweaty exercise clothes for long periods. It's best to wear cotton underwear and change it daily. If your sexual partner experiences symptoms, it's important for them to contact their doctor right away. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, skip the missed dose and take your next dose at the regular time. Do not take a double dose to make up for the missed one. Keep Miconazole 1 kit at room temperature and away from children and pets. Do not flush it down the toilet or pour it into a drain unless instructed to do so. When it is expired or no longer needed, make sure to properly discard this product. You can consult your pharmacist or local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.